And we're unique in this community in the sense that, you know, we're a military community and our military's already been impacted. Our federal workers, our DODEA teachers on Fort Bragg and others, we're already feeling this impact. And so our message from the county is that, look, this is a time that we can come together as a community. This isn't about who you are or anything else. This is about us taking care of each other as neighbors. And we're wanting to ensure that that credible information is out there. We're also telling you that we're going to be in this together. Right now, the county is fully operational. We are doing our day-to-day work right now, and we'll continue to do that as long as we can, or as long as, you know, unless there's a change in the resources. What I also want people to understand is if you need help or someone needs help, call 211. 211 is an incredible service, or go to their website. If you're a nonprofit and you want to plug into what United Way is the power behind 211, 211 has resources for people with mental health, food insecurities, housing, utilities, whatever you may have an issue with, call 211. And don't wait. If somebody's in, you know, having issues, go ahead and call, make that connection. If you're a nonprofit, if you're a church, you have a nonprofit that may help in mental health or food insecurities or whatever, plug into 211, become a partner of 211, and be able to help our community. Look, the thing I know about this community, especially the military side of us, is that we take care of each other, that we never leave anyone behind, no matter what. And I know that what this community is going to do is what I'm focused on as the chair. I think we were one of the first ones across the state at the county level to step forward. And some people looked at me when I had an emergency meeting saying, "What are you doing? You're going to cause panic." And I said, "No, I want to show a community that we're ready." Because that's what we do. We lead when this happens. And we were able to put out that credible information. So just encourage tonight to stay you know, focused on that credible information. This is an extremely fluid situation. You heard it from both Director Jackson and Dr. Green. This changes minute to minute and hour by hour. So just stay engaged. Take care of your neighbor. Maybe that neighbor that you haven't talked to in a couple weeks or a month or so, reach out and say hello to them. You know somebody that's elderly, reach out to them. In your church families, go talk to them. Talk to your friends and families. But if they need help, dial 211. You can also go to the county website, cumberlandcountync.gov. We've got resources there as well. But thank you for showing up tonight. Thank you for leaning in and helping each other in this time. And y'all, we're going to get through this, just like we have so many other things. But it's going to show us that the true grit of this community is how we function when we work together. And that's what's important right now. So thank you for coming out. I don't have a fiery speech like Ms. Hardy, but I'm very focused on ensuring that we're taking care of each other right now in this time. So thank you, and God bless.
Mr. Lamar, I saw your hand. Did you have a question?
I do.
Can you come to the mic, please?
Good evening. As these programs are run jointly by the USDA as well, do we have any figures or any impact upon the farming community in North Carolina or the farming community of the U.S.? Because obviously these food elements are not going to get purchased for this program, and this is probably going to have a severe effect upon the farming community. Do we have a resource at the state level or a designee who works with Cumberland County to address those issues as well?
I'll go first on this. So as far as the farming community, we have an awesome North Carolina Cooperative Extension Office. Lisa Childers is the director. She is fantastic. She works very closely with our farming community. We don't have any data from the SNAP side about the farming, but I imagine that Lisa and her team are collecting that data through the Cooperative Extension Office. We do know that the benefits that we administer will have an economic impact. When you start looking at especially small rural communities that may have only a small grocery store, that when benefits and doesn't flow through, that does have an economic impact. What that is, we don't know yet. Of course, the longer the shutdown lasts, the more risk of impact that you will see in the economy. But I don't have specifically any specific data around farming and how it would affect farmers.
Okay.
Do you have anything?
The only thing I was going to say on the WIC side, in some counties across the state, unfortunately not in Cumberland, there is a farmers market program that is tied to WIC, where you can use your WIC benefits at farmers markets. We've been trying to be a part of that program for the last several years, but they only enroll so many counties every year because of the limited dollars. And so some of those dollars directly impact, of course, farmers, because they sell their food at the farmers market, and then WIC participants can utilize their benefits at a farmers market. So I anticipate that, that's not a program that we'll be able to enroll in this year. And then as Dr. Jackson said, we have about $11.2 million of WIC benefits that get expended in Cumberland County annually. And so that's a big impact, and I'm sure some of that flows back down to our farmers that supply the food that are in the grocery store. So like Brenda said, I don't have those numbers broken down by where those, the sources of those dollars, but we know that our farmers are going to be impacted as well.
Now, is there a department on the state of North Carolina level that would know?
I would think cooperative
Yeah, I think,
or Department of Health and Human Services.
yeah, Health and Human Services. I don't know a number for you on the number of counties that would have that farm workers program off the top of my head. I'd have to follow up on that one. But I think Department of Health and Human Services or Cooperative Extension, I think, would know that.
Because the sheer idiocy of this is that those crops have already been grown to a large extent. Now that we're past this season, and to literally contemplate watching that food rot or not getting utilized is ridiculous at this point in the game, with the level of want that is out there. So anyway, thank you for your time.
And I was saying, I don't think we would know. I don't know. I don't think that we're at that stage that would say that food would be rotting. I don't think we're there in 1 month into a shutdown.
I don't think we are
So,
there.
yeah,
I
so,
just want to make certain we don't get there.
Right. And our benefits for the SNAP program, we average about $13 million in benefits a month.
Right.
Coming into the economy. Yeah.
Thank you
In
so
the
much.
regional economy.
Thank you for coming out. Thank you so much.
Absolutely.
For your time.
Yes, this question I have, you may know or may not, but the whole premise of cutting SNAP is to bring down the federal budget or to save money. My question to you is, what percentage of the federal budget does SNAP call for? Is it 1% of the federal budget?
I do not. I don't have that information on the thank God we don't manage the federal budget. So I don't know if I have that percentage of.
Dr. Hardy says about 1%.
About 1%. Okay. Good.
That's what I was
Yeah.
thinking. So in cutting programs that account for 1% of the federal budget, you would ask, why are you going after these programs when other programs seem so, obvious that we need to cut, but they don't. But they're going after, crumbs when they should be going after the big cuts that makes a difference. And my question is, why are you doing that?
And that's not a question that Jennifer and I can answer.
Just wanted to put it on the record.
Yeah, I understand. We understand.
Okay, I just want to clarify. What is EBT, WIC, SNAP, Flex, and Infamous? What is it?
Okay, so let's start. So SNAP is a Supplemental Nutritional Assistance Program. That's what they call for lack of the most common name for this is food stamps.
Oh,
okay, so it's called, at the federal level, it's called the Supplemental Nutritional Assistance Program, SNAP. That same program in North Carolina is called the Food and Nutrition Program. They're the same. North Carolina has the authority when they are getting federal benefits to change the name of the program. So at the federal level it's known as SNAP. Here in North Carolina it's known as the Food and Nutrition Program, same program. And then the EBT, that's electronic benefit transfer. So when a citizen is approved for SNAP or food and nutrition benefits, the benefits are issued on an electronic benefit card, like a debit card. And it's called, and so that's called EBT, electronic benefit card. And so that's right, they don't issue stamps anymore like they used to, or people could come and get a book of stamps. Now it's done just like a debit card, and it's called an EBT card. So that's the card that the benefit actually goes on.
Okay, is it one for children and one for adults?
That's more on the WIC side. So WIC is women, infants, and children. So pregnant women, infants and children that are before their 5th birthday are eligible for WIC based on your income and some nutritional guidelines. So I think one way to think about it is public health administers the WIC program, and Department of Social Services administers the SNAP or food stamps, or people call it EBT, that program. Our departments work very closely together, even so they're 2 distinct programs, but our teams work together to make sure if somebody is eligible for WIC, we want to make sure that they're eligible, if they're eligible for SNAP, that we're getting them literally across the street to apply and get those benefits. And oftentimes for WIC, if you are eligible for SNAP, or food FNS, or what they call food stamps, you're going to be eligible for WIC. So our teams work together to make sure programs, citizens are enrolled in both if they are eligible.
Okay, and one more question. What is the Flex card?
I'm not familiar with the Flex card. We don't utilize
Is
that.
that with the insurance through Medicaid?
Or you think maybe your Flex spending card, or for your health insurance benefits. So that's not administered by our other public health or DSS. But I do want to go back to another point that you made. So for women and infants and children, your benefits and your food packages do look different. So every pregnant women need different food and nutrition than what an infant does. So an infant's going to have formula, and a pregnant woman is going to get different types of peanut butter, milk, bread, and cheese. So those packages are tailored to the citizen, but they look different. And so that's a little bit different than DSS, that has a more broader use of those benefits.
Okay, thank you.
Yes, ma'am.
I wanted to know because I have patients that have all these cards, and they're asking me all these questions, and I don't know what cards are for.
So both of you can direct them to us, and then the citizens can also download an app, and it's the same for public health and DSS. It's an EBT Edge app. I think in their app store it has the little egg on it. You can download that, and the citizens can look to see what their benefits are and what benefits they have left. Like Brenda said, when I was in Kansas, the citizen literally got a paper check that they took to the store, and so those days are gone. They can either use it on a card, or they can have it on. They can look on their app to see the benefits they have.
We've modernized it a little bit.
Yes.
Yes, ma'am.
I've got a couple of questions. Can illegal immigrants tap into the taxpayer subsidized health care program? Illegal immigrants, people that are undocumented, tap into Medicaid and Medicare, or even buy the Affordable Care Act benefits.
Okay. So we do not govern, so let me distinguish. We do not govern Medicare or the Affordable Care Act. Those are all the open healthcare plans. That's not what we're under. Under Medicaid as it currently exists, I'm sitting here looking at my staff to make sure I answer it right, there's very small opportunity for someone who is an illegal immigrant to receive services, and usually it's very temporary. That's now. But when the House Reconciliation Bill won, one big beautiful bill, that will change even that. But in terms of ongoing benefits, there are real strict rules against illegals, and an individual must be a legal citizen. Again, there's some singular opportunities, like maybe someone goes into the hospital and have an emergency bill, and it might cover services for 1 month, but not long term. And that will be changing though under HR 1.
So the HR 1 bill that has already passed,
Yes.
basically the answer is illegal immigrants, undocumented people do not have access to those subsidized taxpayer programs. And other than in life-saving emergency situations. I'm gonna frame it like that, because that in essence is what it is.
I can only tell you what the eligibility criteria is that we have to administer.
Got it. My second question is this. It's my understanding that, one, this is the first time ever the SNAP and food programs and the WIC programs have been abused in this way. And two, it's my understanding that there were emergency funds allotted and language that was clear that those programs would be covered using the funds, the emergency funds that are available. But in this instance, those emergency funds weren't being accessed, and therefore you got the Attorney General having to sue to say Congress has already allotted this money, and Congress is responsible for the purse strings, not the executive branch. Congress has already allotted this money to be used for this purpose, and you're refusing to use the funds for this purpose. So were there funds that were...
So I'm going to answer that with, we do not control and have any authority or jurisdiction or anything when it comes to the federal budget and what funds are and are not available. For us, we are only at the local level. We are allocated those funds from North Carolina Department of Health and Human Services. The federal funds comes down from the federal government to the state. They then allocate those funds to us at the local level, and then we're giving criteria from the North Carolina Department of Health and Human Services how those funds are used. So I can't answer those questions regarding contingency fund, any funding at the federal level, and how they do not have access, can use. We can't answer those questions.
Okay,
As it relates to your, you had a question before that. I forgot your question. You did two questions back to back, so I just answered the latter one. I can't remember your first one.
The first one related to undocumented people.
Yeah, but you asked a question in between that. But okay, maybe I missed that.
And I'll say on the contingency funds that people are talking about, that does not apply to WIC. So those are USDA dollars, but that is not applicable to the, or can be used for the WIC program. Those are separate pots of money.
Okay. And the gentleman over there asked a question about the percentage of dollars going toward the SNAP program. The bottom line is this. In HR 1, the Republicans raised to $4 trillion the American deficit, just to fund a tax cut for 800 billionaires. And what we're seeing today is that how on the backs of the 98% of American taxpayers and poor people and needy seniors that need health care, we're seeing the results of that $4 trillion giveaway to 800 billionaires at the expense of our children's food, taking food out of the mouths of babies. And so, Sister Kelly, I'm not nonpartisan about this. I looked at a letter from Representative Richard Hudson today that posed a poll question that I knew was structured as a lie, because undocumented people don't have access to the Medicaid program and the Medicare program, nor to even buy in to the Affordable Care Act using the subsidies. And they want to, as Clarence Thomas said, this is a public lynching of the Negro man. This is like the wave an immigrant in front of somebody and distract them from the fact that these Republicans who control the House, the Senate, and the presidency chose to starve, chose to kill our seniors by denying them health care. And yes, I'm angry about it. I was the only black woman in the room when we negotiated the Affordable Health Care Act to get 66 million people health care. And to see these millions of people suffering at the hands of Richard Hudson, David Rouser, and we need to be calling them at their offices, demanding that they represent us. They work for you. The paychecks that they're getting are coming out of everyone's pocketbooks in here, and anybody that's listening. And they've scheduled all this awfulness to occur till basically after the midterm elections, hoping you'll forget. Don't forget.
That's right. Thank you so much. All right, so we want to hear about Medicaid. So real quickly, there's some questions. And the great thing about having all these resource individuals here is we get to lead with facts, as our Commissioner Kirk Debbie has said. So, Dr. Hart, if you would give yours real quick.
Couple of quick things. Number one, I'm actually running for Congress against David Rouser next year, so vote for me and then we can get him out. Okay, so somebody was asking about grocery stores and farmers and the impact of SNAP benefits being cut. So from multiple sources, I get the following. This is a report finds that in North Carolina, every $1 of SNAP benefits spent generates about $1.50 to $1.80 in local economic activity. In more rural or small town counties, for example, in one county, just using Avery County, monthly SNAP spending was about $300,000 and would ultimately contribute over $500,000 in economic impact. In Buncombe County, the pause in SNAP benefits was estimated to cut $13 million in food spending next month if funding isn't restored. For farmers, research in North Carolina shows that SNAP incentives, which are benefits accepted at farmers markets, account for an estimated 20% of total sales. A statement from the State Health News, SNAP cuts would hurt farmers, the larger food distribution pipeline, and local economies overall, especially in rural areas and small towns. And finally, in North Carolina, there are about 9,200 SNAP authorized retailers. This is for grocery stores. Cuts mean that people have less to spend, and North Carolina's 9,200 SNAP retailers, which could hurt the economy overall. And in lower income and rural communities, some stores depend heavily on SNAP customer volume. One North Carolina market owner said that roughly 30 to 40% of their customers use SNAP. And so as a result of that, this is a major cut, and some of these stores might not be able to stay open, like these smaller stores, for example. And so and that's the thing, like what I say to folks all the time is legislators will never pass a law that they suffer under the weight of. Right? It's if the pain point is here, that's where the law is. If the pain point is here, that's where the law is. It's underneath of them. But I mean, when you've got a president who's having a great Gatsby Halloween party at his Mar-a-Lago estate in Florida, while you literally watch people starve, like that's the space that we're occupying right now. And so it does matter that we think about the entire chain. The farmers, the grocery stores, the farmers markets, like it's the individual folks who can't eat right now, but it also means that if that grocery store closes, all of us that needed to go to that grocery store can't go there now. And if those farms can't get that food to places, I'm actually trying to see if we can partner with some farmers to see if the party can buy some of that food to give out to the SNAP folks. Like, let's see if we can do this thing together. And while mutual aid is wonderful and should absolutely always be an option, it shouldn't be the way people get fed. So that was just my point right there.
Thank you. Thank you. Our first vice chair of the Cumberland County Democratic Party, Ms. Erica Burns.
Right there. So I just want to give a short answer to the question about the Flex card. It is a Medicare Flex card. It's a preloaded debit card provided that's through certain Medicare Advantage plans that allow eligible members to pay for various health and wellness expenses. So that's just a short answer, and if you need further details, we can definitely talk about it after if you like. And a request from me, when you come to the mic to speak, if you don't mind stating your name, I'll greatly appreciate it. We know who these wonderful ladies are, and I think they would love to know who you are speaking to them, if you don't mind. Thank you.
And we'll give it back into you all's hands. Can we get the Medicaid, and then we'll go back to questions. I want to make sure we get all this information.
Yes, I'm gonna talk about, yeah, that's okay, good. I kind of do segue into that. We're trying to decide how we're gonna pitch it here. Okay, so Medicaid, two things going on with Medicaid. First of all, we are was super excited that North Carolina expanded Medicaid back in December, effective December 2023. Okay, 23. God, I'm getting old, but I can't remember dates. And so we're excited about our Medicaid program. At the time, we averaged about 96,000 citizens receiving Medicaid, but with the expansion, we've grown to almost over 125,000 individuals receiving Medicaid. That's almost 30,000, somewhere between 25 and 30,000 new individuals receiving Medicaid in Cumberland County. However, with H.R. 1, one of the things that we are concerned about and we're watching really closely is any changes to Medicaid. As I talked about the changes related to H.R. 1 and SNAP, we're also going to see similar changes in the Medicaid program, including work requirements, requirements that individuals will have to have their reviews and recertification done more often, limiting certain programs and access to certain medical services. But more importantly is the future of Medicaid expansion, and that will definitely be dependent on the North Carolina General Assembly when they come back into session in terms of decisions that they make, whether or not Medicaid expansion will continue. And so we're super concerned about that because we know the benefits that that program has had in our community, and we'll be watching that really, really closely. In addition to that, we have gotten a lot of concerns and complaints over the last several weeks regarding the Medicaid provider rate reduction in North Carolina. Now, let me do a disclaimer. At the local DSS, our job when it comes to Medicaid is determine eligibility and issue the Medicaid benefits for those that are eligible. We do not have authority or jurisdiction over the provider service, meaning once the citizen receives the benefit, then they have freedom to select who their provider is going to be, whether it's their doctor's office, their home health agency, their pharmacy. That's all handled at the state level in terms of who is provider enrolled, meaning that they can accept Medicaid payments, and then what those payments and rates are. We are hearing things, we heard even today, that some doctor's offices, because of the rate reduction, are selecting and opting out not to accept Medicaid patients, or they're reducing or they're capping the number of Medicaid patients that they are accepting. We are hearing, it is even affecting us related to therapeutic services. For instance, we have foster children in care that may be in a therapeutic group home. We're hearing, hey, instead of taking 8 kids in this group home, I'm taking 6. We're hearing a little bit about it affecting some businesses and whether or not they'll be able to sustain. And so we are watching that very closely. We are directing those individuals to North Carolina Department of Health and Human Services because we do not have jurisdiction over that, but we are certainly monitoring and watching the impact. And it is a domino effect. I think sometimes everybody doesn't realize how much and how many programs are impacted by Medicaid. So if your loved one is getting a letter from their doctor or saying, hey, we're not taking Medicaid patients anymore, that is what's happening. It is around the rate cut. And so I wanted to make sure that that was out there. It's just a lot happening. Federal shutdown, you got HR 1, and then you got rate cuts, all happening around the same time. And I think Jennifer wants to share about the impact of the rate cuts on public health.
Thank you. So for folks that are maybe not familiar, those rate cuts impact those provider services differently. So the rate cuts that providers are seeing are going to be anywhere from 3% to 10%. And which, 3% may not sound like a lot, but for a small provider, especially in our rural communities, 3% is a big rate cut, and especially for our rural hospitals, those 10% is a large rate cut. So we're not immune to those rate cuts at the health department. We are going to see those impact. Those went into effect October the 1st. They delayed them for a month until November the 1st. Those prepaid health plans didn't put them into effect yet to try to see if they could get a deal at the state level. That didn't happen. And so what we're doing at the health department, we are delaying the implementation of those rate cuts. So we are going to sort of bear the brunt of that. We get our fee schedule approved by our Board of Health, by our county commissioners. We think it's a little bit hard to project right now because we also don't know the impact yet of the Affordable Care Act and those subsidy changes. Probably about $170,000 or so, but we don't know the exact dollar figure yet. So because we don't know that, we are going to delay those rate cuts. What we're preparing for is that if other providers in the community limit or cap their patients, those patients have to go somewhere, so they will come to the health department, right? We're anticipating that they'll come to our child health, or they'll come to our immunizations clinic, or other services that we provide. And these services or rate cuts impact a range of services. So everything from family planning services to our care management program services are going to be hit. So it's not just one type of service, it is across the board. And the rate cuts vary, dental services, so lots of different things beyond just sort of traditional physical health care that we think about. So we're monitoring that closely. We're sort of preparing ourselves to see a little bit of an influx of patients that may switch their provider to the health department, which we are getting ready for, and then trying to be, we have lots of different case managers at the health department, and getting our case managers ready to be able to help explain that to our local citizens if their Medicaid benefits have changed.
And I just want to reiterate a couple things that they said, and I'm trying to be sensitive to our staff that's here and their staff roles and their nonpartisan roles. A couple things you heard them talk about Medicaid. Remember, Medicaid, we're seeing that at the state level, the expansion that we saw. How does that impact us, or how does that impact your neighbors? What you're going to see is you heard them talk about, as the providers as their reimbursement rate decrease, you could have less providers in our community. So while it was great over the last 2 years, we saw this expansion of healthcare, and we've seen people be able to get the care that they needed, the preventive care that they needed. Now what you're going to see is you're going to see less providers. We already had a shortage of providers to start with, which was a crisis or an issue when we expanded Medicaid that we knew. But now you're going to have less providers. That's going to put additional stress on our health department as they shift, limited resources there. But it's also going to begin to stress our emergency rooms. Because if you recall, before Medicaid expansion, people went to the emergency room because that's the only health care that they had. And so we're going to see, and now those emergency rooms, their reimbursement rates are going to be lower. We're fortunate in this community that we have a strong healthcare with Cape Fear Valley, but it's going to take an impact. And so the impact that we'll see in this community is where people go to get the health care that they need. And I'll tell you, the other domino that can fall, and they talked about it a little bit, is you'll hear something called a trigger at the state level. If there's certain reimbursements rates that fall at the federal level, if they pull them back, our state General Assembly has the ability, they put a trigger in, or a poison pill, whatever you want to call it, in the legislation that expanded Medicaid, that then they can withdraw expansion. So we can go back to being one of the states that do not have expansion. They have the ability to do that. That is a simple majority vote in both the House and the Senate. Of course, it still has to go to the governor, but that is a trigger that they can pull. No, it doesn't even have to go back to the governor. It's a trigger that they can pull because it's in the legislation. That's right. So that hasn't happened yet, but that's another domino that can fall. So as we're seeing a lot of these things that are happening, they're all compounding upon each other. But the impact that I want you to realize at your level is if you know people that have expanded or have engaged with Medicaid, their providers are going to be smaller. Where they can go may be smaller, so they need to check with their providers, their primary care providers, to make sure they're still carrying it, or decide where they need to go to get help, where they can go to get care. And then just the impact that we're going to see across the community. This is going, she just walked out, but this is going to ripple on our economy as well. Because you're going to see businesses close, you're going to see, the provider, the healthcare infrastructure and ecosystem that we've been able to grow over the last 2 years because of this expansion is going to be impacted. These are all compounding things that are going to happen. And some of which, even when the federal shutdown hopefully gets over, we still have to deal with these things because they're still going to be right in front of us. So I just want everybody to be aware. Again, get the factual information, but that's how it affects you every day in the community. Thank you. I just wanted to make that point.
I want to open the floor to my friend in the yellow who has a question, and then Veronica has some online questions that have been lifted we want to bring forth, and then we'll go back to the floor. Come on forward.
Well, I know you've gone on to Medicaid, and I think I'm not sure if this is going to be addressing you, but are we as a state able to fund homestead and small family farmers? I know it's been said that USDA is helping small farmers, but since SNAPs are used at farmers markets and other grocery stores, could we partner with grocery stores and farmers to get foods not sold due too soon to be spoiled, be placed into the mouths of the families?
That's not Jennifer and I's area. That may be probably a better question for like the state cooperative extension and maybe our food banks of North Carolina. That may be, I know that I'm on the Fayetteville Urban Ministry Board, and I know they do some work with some of the grocery stores and things like that around helping to stock their food pantry. So that's probably not something we can answer to you. Yeah.
I will say we have a food policy council, and that food policy council is actually meeting right now. Their meeting is on Monday nights, and so our other WIC staff is there giving the same updates to them. But we have farmers that are on that council, and so we'll get some. I'll have to follow up. I don't know the answer to the homestead question. But the programs that would allow WIC beneficiaries to use their benefits at a farmer's market is a particular program that counties have to enroll in. That enrollment for counties is capped right now because there's not enough funding in the program for WIC beneficiaries to use their benefits at a farmer's market. So that one right now is not a possibility for us, and the enrollment on that is paused. And not necessarily because of the shutdown, but because there's not even before the shutdown, there weren't enough dollars in that particular part of the program.
But a question for you, since the people who are participating in SNAPs, will you make allocations or make provisions for people who have to, take their monies and put it towards gas? and they can't get to your office to fill out the paperwork.
So-
would you have more online?
Yes, so we do. Citizens can apply online through ePass. They can just type in North Carolina ePass and it'll pop up. You can go to you go to the county's webpage. You can go to the DSS landing page. You can go on the state. It's widely advertised that they can apply online through ePass. And we do have an online application, especially for citizens that live in rural areas or have transportation issues. Absolutely, they can apply online.
Thank you.
You're welcome.
And while Commissioner Jones is on her way to ask the questions that was lifted online, getting their appointments. Additionally, with Medicaid expansion came a program called care management. And so if you have a child or an adult who is a Medicaid recipient, then they have a care manager. And with that care manager, and it's important that some folks don't even know they have the care manager, which is a huge problem. And I'm fortunate to work with several from here to the Virginia line in this. Make sure that you're encouraging them to find their care manager. That care manager will help them find a doctor. They will help them find transportation. They will help them find resources. That's their job, to support the individual Medicaid recipient. We clear on that? So we can help our community folks out by telling them to utilize every resource available, because we do not know how long this resource is going to be available. So it's better to go ahead and get those things in place. Come on.
And that's a very good point about the care managers. And I think sometimes, our citizens get inundated with information, but trust me, they're getting lots of information about their care managers. Care managers reach out to them, and they may think, oh, that's just another government person calling me. If they take the time and listen, they'll know that there are resources that they can help. We know they get inundated with information. But they can also call our office and we can help them navigate. We have a great Medicaid call center that will also give them that information, but information is on their cards. Information is they're getting mailers, they're getting texts. The state is doing a very good job of getting information out to the recipients.
And for our pregnant women, we have a program called Care Management for High-Risk Pregnancies. So all of our pregnant moms that are high risk, their care manager is at the health department, and so they have one. And then we have a program called Care Management for At-Risk Children, that's CMARC. And those it's a team of social workers and nurses, so they have an assigned care manager with us as well. So they might have two care managers, and so those care managers are going to work together. But I think that's an excellent point, making sure they're reaching out back to us, and we will reach back out to them as well to help do some system navigation.
Well, I just want to say all that's well, but those care managers will reach out to home health agencies in a lot of situations. Now, when COVID came, we had to give the employees a raise. Most of them $14 to $16. I just heard last month that they're cutting that salary back, $3, taking $3 back from us. And so now it's just getting hard to get staff to work. We just don't have the staff across the board. Nobody is working because now they've tricked us into giving them raises. We can't take the raises back. So the people that need home health, really, they're in a bad situation because some of them can't do anything for themselves, but still we can't find anybody to go in and work. So when the care managers and everybody's calling me and saying so-and-so needs an aid, and I mean, they're doing their job, but I just can't do mine.
Especially those rates.
I can't do mine.
And those are the provider rate cuts, and we understand.
Yes.
All right, we did have some online questions, and I'm going to be mindful of the time. Let me take the opportunity, I didn't get to do so earlier, to say I want to thank Mr. Derek, the president of the Cumberland County Democrats. I reached out, and actually we have a reporter to thank. We thank all of you for your job, but Paul works for City View. He sparked a question at one of our emergency meetings, so I want to make it clear. I do serve as the vice chairwoman, county commissioner at large, but today, this meeting is about the public. and I'm here just as a public servant. And so I wanted to say he acted quickly. The question was presented to us, will you be taking this information back to your parties? And as I stated on the record then, which I will now because you all know that I'm in this seat because I'm going to speak truth and I'm going to stand for the people because I work for you all. So he asked what we would do, and I stated, yes, I will talk to our Democratic Party. As I'm a Democrat, we are partisan, not nonpartisan, but we do serve for everyone. So I just wanted to take time to thank him and also Bishop Wright, because immediately as Bishop Wright serves for the Democrat as the president of the Men's Democrat, and you serve as our overall chair for the Democrats. And again, let's be clear. I'm here today as a public servant, not representing the board, but that has already been put on record. What would we do? So that's what I did. I think we as leaders have to work together. We have that responsibility. With that being said, we appreciate those that are listening from home, as well as those that showed up today. So we don't want to go, we want to make sure they took the time to fill out the form. So we're going to ask these 4 questions. The first question is for you all, Dr. Jackson, and also for Dr. Green. How will this impact child care assistance for those providing substances? They want to know, will they still have their vouchers? What's going to take place in that? Is there going to be an impact with individuals that depend on child care subsidy for when they have to go to work?
I can only answer that question at 8:04 p.m. That's what time it is right now. As it stands right now, we have not received any information about any impacts to child care subsidy, which is good. We serve, we have about $2 million in child care subsidy. We serve over almost 3,000 children for child care, meaning we pay, we offset their child daycare services. And so as it stands right now, it is subject to change, but as it stands right now, we have not received any word regarding impacts to the federal child subsidy program. But it is subject to change.
And the second question to write in, and from those that are watching online, this question, Dr. Green, will people whose Medicaid benefits may or may not be affected by their providers, will they be able to be seen at the health department? And if so, they would like to know what is the criteria. What would they have to do? Say if their provider no longer will take their Medicaid, what is needed for them to be seen at the health department is that question.
Yeah, that's a good question. So if you're in child health or family planning or maternity and you have received services from another provider and you want to switch your provider, people and citizens can do that. You get to choose who your provider is. They need to work with our office, and we will bill Medicaid just like another private provider will. So we can work with that citizen if they have Medicaid. And they can call our office 910-433-3600 to schedule an appointment. We'll ask them what insurance they have, and then we can get them switched to us as if they have Medicaid. I will say that if you, for example, have an annual visit for child health and you've already had your annual visit, then we might need to we need to talk with them about the billing part of that. But they can call our office and we can get them enrolled with us as their provider if they so choose to do that.
And there's 3 more questions. And this one, although we don't have someone here from the Cumberland County school system, I know the answer. Will children still get reduced lunch? And I can state that the superintendent, Dr. W.I.C, has informed us at our emergency meeting that no child will go without food and that every child in Cumberland County will still receive food if they need it at school. So I can answer that one. So our last 2 questions. This question states, will there and are there going to be any cuts for DSS and the health department? Will doctors, nurses, and social workers be laid off? Or have they already?
Yeah, we are staff. We have not laid anybody off, and we are working really closely with of course, our county commissioners and our county management team to understand what current dollars we have, what the long-term dollars are going to be, what's going to happen if we have this extends, months beyond. But Brent and I, on a regular basis, are in communication about what dollars we have available. And you know, I think the intent is to make sure that we are taking care of our staff, because they're the ones that need to be available to serve the citizens. And if we don't have staff, then we can't serve the citizens.
And I agree with everything Dr. Green has said. And the only thing I would add is, again, we have to compartmentalize this. For the federal shutdown, that's one issue that we're facing. But for HR 1, we are very concerned that two things. One is, for the first time in the history of the SNAP program, counties may have to pay a percentage of the benefits that are issued. And that is huge when you start talking about somewhere around about $20 million. Also, too, any reductions in our administrative costs will impact staffing. We need the staff to do the work. We're not there yet, as Dr. Green says. We are assessing every dollar. I think it was incumbent upon both of us to try to put forth a fiscally conservative budget as part of our department's requests, in the understanding that there are going to be some difficult decisions. And so we're also in very close communications with our county manager, Clarence Greer. Matter of fact, we had a meeting today. Our finance, our budget staff. I've been very transparent with my staff, is we got to work. We may be working harder, but we also got to work smarter in the work that we do. So we certainly need the staff to do the work, but we need to be looking at every efficiency that we can possibly realize as we do this work. And so, you know, the commissioners will have some major challenges facing them, and it's incumbent upon us to support the work and the decisions that they'll have to make as we go into these coming years. So the issue is not just today in the federal shutdown. It's 1 year from now, 2 years from now, 3 years from now. This could have lasting impact.
And I'll say on the public, on the public health side, we've seen really, you know, if you turn on the news, there's conversations at the federal level about cuts to public health, and so we're not immune to that either. We're very fortunate that we have not had to cut any staff due to the larger cuts at the CDC or some of the other federal public health agencies. We've moved some money around in some instances within the guidelines that we're allowed to do that, but we're very fortunate we haven't had to do that. We've seen smaller cuts to our budget in some of our programs, or we've seen delayed funding, but we have not had to cut staff. So we're very fortunate. But those are things that we're thinking about as we encourage investment in public health.
And then the last question states, will all WIC locations, if you could name those, still stay open, or will some be closed? And then the other one states, will Child Protective Service outreach workers still work their normal hours?
So we still have all of our 4 WIC locations are operational. Our Ramsey Street and Hope Mills locations are open Monday through Friday, 8 to 5. And then our Spring Lake location is open Monday, Wednesday, Friday, 8 to 5. And then our Fort Bragg location is open Tuesday, Thursday from 8 to 5. So those are all staffed and operational.
So the programs at Social Services and Public Health are federally mandated and some are state mandated. The question becomes, how do you administer the mandated programs with the funding that you have? As far as Child Protective Services, that is a 24-hour, 7 days a week, 365-day-a-year job that we do. Our core business hours are 7:30 in the morning to 5, but we work 24/7 in our efforts to protect children and adults. We have adults that are victims of abuse, neglect, and exploitation as well. So yes, we will continue to do that work. There is a need in our community, and we want to make sure that we do that to the best of our abilities.
And we want to thank those that wrote in and online questions, and now we will go back to that of in-person here questions. Thank you so much.
Good evening. My name is Mario Benavente. I'm one of the city council members here in Fayetteville. And one of the concepts I try to communicate to my colleagues is the inexorable tie between public safety and public health. That really issues and interruptions in public health can lead to decreased public safety. And, you know, I'm an attorney by trade, and I see it already. when there are different agencies that are meant to give recommendations to sometimes our juveniles, that sometimes the difference between a young person going to W.I.C and going to a group home is kind of, as you said before, their availability and how many spots they have open, and certainly reducing that sometimes leaves people in the lurch. I guess I know that you all said you're all tracking a lot of these things. I wanted to know if perhaps y'all are tracking as well the impacts potentially, like you said, downstream to affect public safety when folks are not getting the services they need from either of your departments.
So I can't say that we are tracking it in terms of data tracking. We are definitely having those conversations of the impact. And I think Commissioner Chairman Devier, excuse me, mentioned it as well. It's going to have an impact in every part of our society. And I think that people are going to realize how much the work that we do in providing those federal programs really do impact us. Excuse me, I got a tickle in my throat. And so we're looking at child welfare. What's going to happen when programs close, right? What's going to happen? What are kids going to do? How are kids going to act out? How are they going to be able to handle? Mom can't put food on the table. Mom cannot buy the sneakers that they want. I mean, it is going to have an impact on everything that we do. And it could lead to children acting out and those kinds of things. What are people going to do when they can't feed their families? I always say good people in desperate times do desperate things. And so it's some major challenges that's going to be facing our community. And I don't think anyone is going to be immune to the impact of it. Sorry about that tickle in my throat.
I can think about two federally funded programs that we have that directly impact public safety. So we have one from the federal SAMHSA administration that supports our first responders and naloxone distribution and training. That we're so far we have received our funding. We have gotten the benefit. We continue to be able to draw down funds, but that funding provides naloxone for our first responders at our detention center. That provides training for our some of our juvenile crime prevention programs, and so that has a staff of peer support specialists and health educators. So if that goes away, it's a newer program, but it's a resource that we've tried to leverage to get training for those that are on the front lines doing the work. We also have another program through the Bureau of Justice Assistance that also is a diversion program. And so that helps to support our lead expansion with Fayetteville PD, and that's a directly public safety. That's federally funded. That provides an additional some Fayetteville Police Department time, but it also provides a diversion specialist and then also provides some sort of wraparound service, case management. And so all of those things, as we said here tonight, have that downstream impact of if those dollars go away, then we're going to see sort of the safety net of programs that we have really be impacted. And we, in our teams, have worked really hard to stand up some of these things. And so we, one of our deputy health director says public health is, if nothing else, but you do a lot of pivoting in public health, but we don't necessarily like to do that, right? We'd prefer to have a solid footing to stand on, and that allows us to have sustainable program and services. But I think, as we said, we will see the downstream impact of that if we continue to sort of poke holes in our public health system.
I just want to highlight one thing for all the Democrats in the room that Madam Director had just said. There's a saying that, society is only 9 meals away from falling into anarchy. That when people are hungry, we've seen it, throughout time, that's when things can get, sort of dangerous all around. And it's hard for me not to imagine that the same president who's trying to drum up drama by sending the National Guard places, that's trying to drum up drama in communities, that this is not a part of that. That when you make things stressful and more difficult and potentially dangerous for people, then all of a sudden they've got an excuse to sort of run roughshod, that they have an excuse now to declare martial law and cancel elections. And again, this is about facts here, but there is also a partisan element here where we have to be aware of the game that's being played here and obviously do our part to keep our community members safe. and to provide them with what we can, and obviously connect them to the resources and those folks that are trying to do it on a daily basis. Thank you.
I would like to say in closing, we want them to come back again in the future, so we definitely do not want to rob them of all this extra time. But I do want to say personally to Dr. Green and Director Jackson and your staff, thank you all. Thank you for coming to just share. Did you all enjoy this tonight? You're so helpful. Thank you. I know some of you got children, you got responsibilities at home, and you're probably tired. And so we definitely want to get you out of here. Thank you all for coming. Thank you all for watching. Thank you for our elected officials, candidates. I see you all are in the space tonight and gaining information and share this information out. Please, please, please share this information out. Let us not get it and hold it, but let's help our staff of the county get this information out and educate our folks. So we're making the right moves and we're being smart about our decisions. Amen. Since we're in the church. All right. So any other closing statements from any of our representatives who are here tonight? Any statements?
Remind the people to vote tomorrow if they have not done so.
Hello. That's right.
Oh.
Go ahead. Go ahead.
So if you have not purchased your tickets to our fundraiser dinner from Selma to today, the Unfinished March for Justice, it is next Friday, the 14th, November 14th, 7 p.m. at the Skyview on Hay Street. We'll be honoring two amazing women, Dr. Ora Mobley Sweeting and Dr. Jeanette Council. What do you Commissioner Dr. Jeanette Council. We'll be honoring both of those wonderful women who served as civil rights activists right here in Cumberland County. So if you have not purchased your tickets, please do so. They are no longer early bird, correct? What's the price, man? $60?
$75.
You got it.
$75 for a ticket.
You got it.
But I need you in the building. I need you there, okay? Please come and support. And again, if you have not voted in early voting, please do so tomorrow. We definitely need good people on our local level. So please, please, please exercise your right to vote on tomorrow. The polls open at 6:30 a.m. If somebody needs a ride, please call us. I have taken off tomorrow. I work for this wonderful, but I have taken off tomorrow.
I wasn't going to call you out that you work for social services. We're real proud that you work for social services.
I have the pleasure of working for this wonderful woman, but I did take off my own time, okay? So I will be around the county tomorrow. If someone needs a ride to vote, it's going to be Uber Votes tomorrow, not Uber Eats. I'm not taking them to the grocery store. I'll take them to vote, take them back home. We have a few people that will be doing that on tomorrow, along with observing the polls and make sure things are going as they should go. And thank you all for coming.
The polls open from 7 a.m. to 7:30. Make sure you ask your friends, your neighbors.
6:30 a.m.
6:30 to 7. Say it again.
6:30 a.m. to 7 p.m.
6:30 a.m. to 7 p.m. Please make sure your neighbors, your cousins, your friends, your associates, and your enemies go and vote.
Yes, please.
Hello? All right. Okay. Mr. Ojeda, you say you want to say something before we close?
I just want to say, my name is Major Retired Richard Ojeda, and I'm running against Richard Hudson.
All right. So, out of respect for all beliefs, we'll just conclude with amen.
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 Amen. Amen. Amen. Have a wonderful night. Drive home safely.